present the results of tests from the coronavirus disease 2019 that we know as COVID-19. The results we've received so far today are that we've had 16 people testing negative. What is important about this is that amongst them are the results of the one woman who's just passed away who was a suspected case of COVID-19. Our condolences go to the family in this difficult time. I would like to talk further about the results of that woman. This patient was admitted in one of our hospitals. It's been in the media and in social media as reported as a suspected case. She was admitted on the 29th. She had difficulty in breathing. She showed symptoms that are similar to that of COVID-19. It is true that one of the nurses wanted to seclude herself because she was afraid to work with her. However, she was helped and she was isolated and she was treated and tested for COVID-19. So amongst the results I'm announcing today, amongst the 16 is her results. She tested negative for COVID-19. She was 33 years old. She had an underlying condition from October last year when she was first treated at Mabane Clinic. She had been treated throughout that period to now. I am announcing this because it has appeared in the media, it is appearing on social media, and we would like to clear all the myths and around the issue. She was ill, she was treated, she was tested, she was negative, and we would like to pass a message to the country that the Mbabane Clinic did everything they needed to do, even though there was fear amongst one of the nurses. I would like to encourage all health workers to continue working hard, protecting themselves. We recognize that there is always fear because this is a new disease, and nurses and other health workers are concerned for their own safety. There are protocols, people should follow the protocols and protect themselves and help the nation. The second issue I would like to address today is that of the people that are now free of the coronavirus. His Excellency mentioned that what we refer to as our case zero or our patient zero, the first person to have tested positive in the country, she's now been discharged home. In the treatment, once you test positive after treatment, negative after treatment, we test you again. And when you test negative, then you are free to go home. What is really important is that these people who have gone through the disease, who have suffered through the disease and have conquered and are on the other side, they actually have developed immunity in their own bodies. It means that they can go home, they are safe, they are not going to infect anybody. As a Ministry of Health, we would like to encourage families, friends, and communities to welcome people back. Because of all the people we should be concerned about is those people we do not know of their status, whether they have the disease or not. If you've had the disease, you have developed immunity, and you now test negative, it means that your body has developed the necessary antibodies to fight against the disease. So you are safe to everybody else. We do realize that there is fear, that there is concern, that families are concerned, but when we test anybody and they go for treatment, we go to test the family, we go to test any contacts that they have had, and we make sure that people are tested and are treated accordingly. So we do very strongly encourage families, we encourage friends, we encourage the nation that in the next few weeks we are going to see more and more people testing positive. We are going to see more and more people who have a mild form of the disease, as we've seen so far, recover and go home, that it is okay for people to be back home, it is okay for people to be welcomed back into their families and into their lives. This shows us that people can overcome this disease. We do know that over 90% of people are going to have the disease, and they're going to recover, and they're going to be fine. So the nation should continue to watch themselves and make sure that we welcome people back. As a ministry and as government, we would like to continue encouraging the nation to stay at home. Let us not move the virus. Stay at home as much as you can. At home, make sure that you wash your hands with soap and water frequently. This is to make sure that if you've touched anything where there might have been an infection, you will not infect yourself. Keep a distance from other people as much as you can, and make sure that you cover your mouth and nose when you sneeze or you cough. This is to prevent you infecting other people. And we would like to continue to work with the nation in preventing this disease from spreading across the nation. So please stay at home. Please distance yourself from the next person. Please keep safe for your own sake and for the sake of everybody else in the nation. Thank you very much.